this point is a great point to include in any treatment where you have bone swelling or especially joint swelling. Hi and welcome back to my channel. Today I'm going to talk about one of my favorite Master Tung points to treat joints. This is 11.27 or Wuhu. The name of this point can be translated to 5 tigers. And now some trivia that might help you to understand some of the indications of other Master Tung points. Any Master Tung point that has tiger in it, like this 5 tigers, usually will work on the bones. And this is because there's a Chinese saying that says that the bones of the tigers are the hardest ones in the animal kingdom. So in general, if a Master Tung point has tiger in its name, we will be able to use it to treat the bones. If you'd like to learn more about the techniques that I talk about in my videos, check out the courses I have available. I have courses in Portuguese and in English, so check them out in the links below. In these courses, I teach the balanced method to treat pain. This is a technique where you get instant relief in most pain cases. So if you want to learn about it, check them out. In this case, we're able to treat the bones, but even more specifically, we're able to treat the joints. This point is located on the thumb. As you can see here, it's actually a set of 5 points. It's located in the A line of the first phalanx of the thumb. So the A line, if you remember well, is the line between the red and white meat. So really the division in the middle division on the thumb. To find each individual point, we will divide the area in 6 zones, and in the divisions you will find each of the points. The points have the shenjing of the kidney and the spleen. The kidney tells us that it's great to treat bones, and the spleen tells us specifically that it's great to treat swelling, and this for me is the best point to treat swelling in the joints. The main indications of this point are bone swelling, joint swelling, arthritis, osteoarthritis, and even osteoporosis. The point has some indications for the foot, such as foot pain and even bone spurs. This is obviously both because of the indication of the point and also because of its location in the hand. And if you know how to work with the images from the balance method, it will be obvious to you why the hand will treat the foot. But according to Dr. Who, this point can also be used to treat the lymph nodes. So swollen lymph nodes, you might be able to use this point. In general, I don't think I've ever used this point for that application. Generally, I just focus on bones and especially joints that are swollen when I think of using this point. If you look to different authors, you'll have different opinions, but most authors will tell you that the more distal the point is, the higher in the body it will act. So you will act on the last point, the more distal of the 5 points, if you want to act on the hands, for instance, and you'll act on the more proximal one, or the first one, if you want to treat the foot. I don't follow this rule strictly, but I use it as a guideline. Usually what I will do, because I never use the 5 points at once, I will select at the most 3 of these points, is I'll palpate the points and use the 3 that are more sensitive for the patient. But if I want to treat an ankle and the first and the last point are both equally sore, I'll just use the more proximal one, because the theory tells us that it's more helpful for the feet. But the main thing for me is palpating all of them and evaluating which one is more sensitive. You can use this point by itself or in combinations using the balance method, other Master Tung points. Now I'm going to give you a very quick example of a situation where I use just this point, but in general, if you're treating bone swelling or joint swelling, in most cases patients will have more complex problems, which will make you have to use more points. So you'll have to do your full diagnosis, but this point is a great point to include in any treatment where you have bone swelling or especially joint swelling. The case that I'm going to talk about, it happened in one of the clinics where I work, and the receptionist was having a lot of pain in her thumb, in her thumb joint. She didn't know where it came from. She was worried, well, maybe there's an arthrosis forming, maybe it's just inflamed. She didn't know, and I wanted to help her, but she was during her work time, so I couldn't do a full diagnosis, and I couldn't take her to my office to do a full treatment because she needed to be by reception. So I just looked at her and said, well, I'll just add one needle and maybe it will help, because as she couldn't bend her thumb well, it was bothering her while she was writing. It was bothering her while she was trying to even type on the computer. So it was not nice for her, and the pain had been getting worse and worse in the last days. So what I did is I went on the opposite side thumb, so it was her right thumb, so I went on her left side and I palpated the more distal of the 5 tigers, so the last one, really close to the middle joint, and the point was very sore. I just inserted one needle and asked her to move her thumb, and she told me that the pain was almost gone. I left her with the needle and came back to take it out after 30 minutes, and the pain was completely gone. I still haven't seen it after this treatment. I'm convinced there will be some lasting effects. I'm almost sure that the pain will not come back fully, but maybe the pain will come back and she will need a proper treatment with a full diagnosis and maybe other kinds of points. But this is just to illustrate the potency of this point. This is an amazing point. If you see patients with bone swelling, with problems with their joints, particularly if it's swollen, I urge you to think of this point, because I'm sure it will help and it will complement and make your treatments a lot better. Thank you so much for watching. If you like this video, don't forget to like and subscribe to the channel and share this video with anyone that might benefit from it, and I'll see you in the next one.